Most people face psychopharmacology not because they don't know the medications, but because they miss the clues. Psychopharmacology questions test judgment, not memorization. So one of the mistakes is overthinking instead of eliminating. Stop analyzing every word. Two options are unsafe. One is irrelevant and one is correct. So think clinically, not chemically. The second mistake is forgetting black box warnings. Clozapine, like I said in one of my videos, is associated with agranulocytosis. SSRI in youth is associated with suicidal ideation. Valproate or Depakote is associated with liver failure, and MAOIs is associated with hypertensive crisis. So if the question mentions danger, that is your clue there. Another mistake is mixing up side effects and adverse reactions. When it's mild, it is side effects you teach. When it's severe, it is adverse reaction. You stop and notify the doctor. That one distinction can raise your score instantly. So always think like a safe nurse, not a scientist. Ask, is it life-threatening? What is my safest first action? What should I teach or monitor? You don't need every receptor. You just need to keep your patient safe. If this spoke to you, remember to follow me, subscribe, like, comment, and share this video. And I will see you in my next video.